Hi, today's Thursday, the last case of the day for the week, the 67th. It's titled Two Primaries and One Metastatic Lesion. What happens now? So, today it's more a question and something for you to think about. And I don't have the answers, I'll tell you right away. So, 76 years old, greater than 20 pack years history of smoking, has chest pain, gets a CT done. There's a mass, it's under 5 centimeters, involving the rib, necrotic. Um, and there's an arterially enhancing renal mass that was picked up on the chest, abdomen, pelvis scan. So, the patient was sent for a biopsy earlier, or actually late last week, and the results came in earlier this week. And the lung mass was poorly differentiated non-small cell carcinoma with squamous and glandular differentiation, and the renal mass is a second primary, a renal cell carcinoma, WHOI sub grade 2. So a PET was done yesterday. MR brain was also done, which is normal. And you can see here there's the lung mass, nothing else, one acetabular osteolytic lesion. So the question is, or rather, so it's T3 invasion, N0, and this is with the assumption that EBIS is negative if the patient is a surgical candidate. So is it M1B? Is this lung metastasis, or is this RCC mets? In which case, for the lung, it's M0. Now, if the acetabular lesion is from lung, then it's stage 4. But if it's from kidney, then it is stage 2B and operable as per all guidelines. And even if it's stage 4A, there is data that suggests that you can operate on the primary, and the oligometastatic lesion in the acetabulum can be treated separately with radiotherapy or SBRT, etc. So what would you do? Uh, Irrespective of histology of the acetabular lesion, just operate on the lung and kidney and treat the left acetabular lesion with RT or ablation, with the assumption that you just treat all three. Or biopsy the acetabular lesion and then decide the next steps. Does it matter whether the metastasis is from lung or kidney if you're going in for surgery everywhere? I asked ChatGPT because that's something we can do. Gave it all the information, and ChatGPT insists that the bone lesion should be biopsied, and based on what it turns out to be, you have all of these options here. So, would you agree? Is this something that makes sense? And that's the case. I just wanted to put this up here because this has intrigued me all of today when I was reading the PET, trying to figure out what would be the thing to do. So in my report, I've mentioned that the CT guided biopsy of the acetabular lesion is very simple, and therefore, if required, should be done. But the question is it required? And you should make a decision as well, or maybe send in your comments. That would be nice. And then I'll do a post and update the description of the video after the final decision and outcome, which may take a few weeks, maybe a few days, but definitely a few days, but probably a few weeks. And I'll let you know. So I leave you with this for the week, and I'll see you next Monday at my WhatsApp channel. Thank you so much for viewing this.